being the president of the organization and along with the chair of the scientific organizing committee, who happens to be my dear friend and colleague, Dr. Steve Frucht from New York. So we have had access to the entire program. Actually, we designed the program, and also to the abstracts. And I can assure you that we are pleasantly surprised by the high quality of the scientific material that is being presented here, to the point that other organizations, they are requesting permission for presenting in their future meetings some of the material that is shown here. So that means that we are really the premier organization, I'm very proud to say that, in terms of as a forum for movement disorders. But I could highlight some interesting points. Let's get started then first with non-physician-based approach. So there are several sessions here which will discuss how we can actually engage different allied health professionals in creating a multidisciplinary team. Because there are some problems, let's take the example of Parkinson's disease, which are not really solvable or improved by medications or surgical procedures and so on. So there are some specific problems, and I can say, for instance, speech problems. They are very much resistant to what we physicians offer. In contrast, speech therapy can be very helpful. Gait problems, which are a major source of problems, disability to people with PD, they start tripping over, falling. This can be improved by physical therapy techniques and so on. So there is a lot of emphasis on the creation of these multidisciplinary teams, and we have evidence being presented here. Second point, now coming more to the medical aspect, and again taking Parkinson's disease as really the prototype of the problem we deal with. The disease is characterized by a low level of dopamine, and we are capable of replacing this dopamine with tablets. However, as time goes by, it is not the case that the tablets stop working, but the patients develop some sudden changes in the manner that the brain reacts to these medications. And these can be extremely disabling, fluctuations. Sometimes they are on, others they are off. When they are on, occasionally they will have excessive unwanted, involuntary movements. And if we have a way of really controlling completely, or at least partially, these complications of the medical treatment, the quality of life of people improves very much. And one of the really key areas right now is the use not of oral levodopa, but infusions. So there is a lot of place for infusions. Some of them, they are already available. They are perhaps a bit complex because they require the placement of a feeding tube directly into the intestine and so on. But there is new exciting data showing that subcutaneous infusion with small pumps can be very, very helpful. So it's quite likely that before we have some really effective treatment to prevent Parkinson's disease, or even to slow down the progression, that these improvements in the way of providing levodopa and dopamine will be quite important. And finally, my last comment regarding these new developments, there is a new generation of ways of doing deep brain stimulation, which is a technique that, rather than using a chemical way of trying to improve the brain function, it's an electric. So it's essentially a pacemaker. Most people are familiar with that by now, but it's a pacemaker with an electrode deep in the brain. So there are new advances in this area that seem quite promising in terms of improving a treatment which is already on its own right now quite effective for a group of patients.